Hello, I'm Dr. Daniel Ebroon. I'm an oculoplastic surgeon in Thousand Oaks, California. And today I'm going to talk to you about a temporal brow lift, or a lift of the tail of the brows. So one of the most common surgeries I do by far is upper eyelid blepharoplasty. And that's a surgery that we do for the extra skin of the upper eyelid, for droopy, saggy skin that makes people look tired. But at the same time that the upper eyelid skin droops, very often there's also a droop to the tissues of the eyebrow skin, especially the skin that's at the tail of the brow. And for many patients, upper eyelid blepharoplasty will make them look better. But if at the same time we also do a procedure to elevate or lift the tail of the brow, we can make the cosmetic result look better still. So when we look at somebody's eyelids and we're looking at the eyelid skin, it's very important to also look at where does the eyelid skin end and where does the brow skin begin. Because if we just take the eyelid skin away and the brow is also droopy, if that's not addressed, then some of the droop is going to still stay there. So it's a wonderful procedure in many patients to enhance the cosmetic benefits of eyelid surgery. When we're working on a brow, there are multiple kinds of brow surgery. There are full brow lifts that lift the entire eyebrow, and there are multiple ways of doing that, an endoscopic or something that's called a coronal brow lift with a large incision. And that has its pros and cons, those full brow surgeries. The pro is that you can really get elevation of the entire brow, but the con is those are larger surgeries, and more importantly, there's a risk when you're lifting this part of the eyebrow that you can look surprised or overdone or look like you've had surgery. And for many, many patients, they don't want to take that risk. That's why we can, in many patients, do a temporal brow lift, or a lift of the tail of the brow, which has a couple of big advantages. First of all, it's not as big of a surgery. There's only one incision on each side, and I'll tell you a little bit more about that in a moment. But the second big advantage is that we can lift the tissue back up onto the brow bone here without lifting this part of the eyebrow. And then we eliminate the chance of it looking surprised or overdone. And a lot of patients really, really like the fact that they don't have to worry about that. How do we do a temporal brow lift, or a lift of the tail of the brow? Well, what I do is I make an incision here in the temple area, right where the hairline meets the temple. It's a wonderful place to hide an incision, and the incision is about that long, and we remove a little spindle of skin. We dissect under the skin towards the tail of the brow. That allows us to lift that skin and elevate it. And then we do stitching to close the incision in that higher position. The stitching involves dissolvable stitches that are under the skin to take the tension off the incision. And then there's also skin stitches that we do here that are removed about the same time we take eyelid stitches away. That combination of the dissolvable stitch underneath and the stitching on the skin, along with the location right at the hairline here, does a really nice job of hiding that incision once it heals, and makes it very difficult to see that incision. And it really enhances the cosmetic effects of the surgery. It makes it so that the upper eyelids look good, but that there's definition here on the tail of the brow without the sagginess of the brow skin, and can really take a good result from eyelid surgery and turn it into a spectacular result by adding the tail of the brow.